those unfamiliar, who don't have microcurrent yet, who just maybe haven't even dived into what their devices are capable of, our devices can essentially have a biofeedback connection with the body. This can be a big, big deal. This seems like very little when you're looking at it on the surface. This is the process, though, of obtaining these critical pathways to get lasting results with our patients or clients. It may seem like it's just a couple of beeps and buzzes, but this is actually making a connection with the brain, and it's asking the brain to pay attention to an area in order to resolve what is a potentially critical issue. How does it work on a scientific standpoint? Because that can be important to a lot of people. So from that perspective, what we are doing is we are inputting an electrical current into the skin. Certain programs have a requirement that when they receive a signal back from the body, we are completing a circuit. So we're actually inputting and getting input back. So we're completing this circuit. Not all programs have this. Common programs would be 60 hertz in the evolution and fMRSI in the evolution. And programs in the Genesis would be like 77 hertz has it. Anywhere where it says that it has the biofeedback connection capacity. For the Pinnacle, this would be a lot. Assess 60 hertz, Blu-Rel 77, SanaSurf 350, anything you build in AVA mode yourself, and so on. It's like an innumerable amount of programs that have this capacity. Now, if you don't want to use this because you're, say, wanting to paint the body, you just ignore that part. It's going to come up. As you're painting, it's going to beep at you and buzz because it's trying to establish these connections. But if you don't want it to, just ignore it and keep going. It doesn't impact the treatment in any real way. So we want to put this input into the body so that we can receive an input back, right? Or an output from the body into the device. When we don't receive one, we get a failed dose/0. When we do, we get that like successful and happy little beep and buzzing, and I almost feel like the device is going to do a little happy dance. This can be used in a variety of ways. Maybe we want to draw the brain's attention directly to the highest point of pain to get it to work on healing it. Another example would be the concept of mirroring, or the good limb, as I call it. This is an approach to show the brain what a good, healthy body part looks like. This would involve, say, a person with chronic left side shoulder pain receiving a dose and a 0, or DZ, on the right shoulder. This then makes the brain look at this and say, this is a good shoulder, and then recognize that something is wrong with this one and start to make those changes because the body is so symmetrical. It's giving a form of a blueprint. Now, dosing and zeroing, as you explore the power of microcurrent, will become an absolutely critical part to the long-term solutions that you can provide clients, because it will get the brain focusing where it needs to in order to resolve the biggest issues in the body. And it becomes kind of an ongoing healing capacity. When you ask the brain to focus on the shoulder, it's not just focusing on it for now, it's focusing on it for a while, meaning that after the patient leaves, they continue to experience the benefits of microcurrent therapy, hopefully towards long-term resolution. So I'm going to do some examples with the Evolution and the Pinnacle, which are the two devices we currently recommend for dosing and zero, well, for practitioners in general. All of the devices can dose and zero to a degree, but just looking at these devices, we'll start with the Evolution here. So I've plugged in my Y probe, and I should have put in a Y sleeve, but I didn't. Don't be like me, use a Y sleeve. So what we're going to do is we're going to select a program. I'm going to go with fMRSI. That is one of the two dosing programs in the Evolution. So I hit the mode button to get down to that point. For ease of use, I'm just going to dose and zero kind of on my neck somewhere. So what I'm going to do is I'm going to attach the device, and I'm going to hold the plus button down until I can feel it. Okay, it's a bit too strong. Okay, so you'll see that I got a blue light coming on. Now, a blue light means that you've got a successful dose on the Evolution. So then you need to hold it in place and wait for all of the lights to come on. So note that I'm not on blue stim, but I've gotten this blue light to come on. This is because the device has successfully dosed. So now we're just going to wait and hopefully we'll get this. Now, dosing and zeroing can take a little bit of time. I'm hoping for the purposes of this video that it will not, but it could be 10 minutes, even longer in some chronic cases. Hopefully, being that there's nothing wrong with my neck, it will actually zero sooner and rather than later, because we just want to make sure that we get that capacity sorted out there. So what we do is we just hold it firmly in place. You can see it's there, and we're just waiting. So the blue light being the dose, what this means is that the device has put the input into my body. And now we are waiting for my body to send that input back. Note that it doesn't seem to matter how far away it is. It can take time to receive those things back. So for example, my brain is very, very close to this area, but it's not quickly zip-zapping back. We'll cover the differences as well. See, that's what you're looking for. That means we got a successful zero. Now, just to note as well, after you've done this, you want to actually switch down to blue stimulation and do a 2-minute treatment. The reason for this is that you want to get your brain to pay attention to the area, and then you start to treat it. The treatment with the healing frequencies, this is going to be the part that carries on, because the brain is now looking and it's seeing the encouragement of regeneration and anti-inflammatory, and that's what the stimulations do, a bit of both. So 2 minutes of that will mean that the ongoing treatment will continue. If you were using a Genesis, it would be the similar thing. Your blue light would go on to see a dose, and then the orange lights would go on to show a zero as well. Now, it's a bit different with the Pinnacle. The Pinnacle being that it has a screen, same thing, I plugged in my electrode. You'll see that you're going to have a lot of different modes on here. So assess 60 hertz here is where I'm going to start. And the backlight is currently on for another few seconds here. There you might be able to see that a bit better. Assess 60 hertz. So what I'm going to do is I'm going to place this in the same spot, and I'm going to adjust the power until I can feel it. There we go. And I immediately, and you should see this in a second here, got a dose really quickly while I was powering that up. Let's just wait for the backlight to turn off. Just doesn't show up good on screens there. So you'll see there's a D on the screen. It says assess D. This D means that the dose was done. So now we're looking for a Z to come, and it's probably going to light up the screen again. But the D is the dose, the Z is the zero. Now, if the Z came first, or even if all the green lights came on first with the evolution, we would have what we call a failed DZ, and you'd have to remove the electrode and try it again. So there's quite a bit to this process, but it's basic across the board. And when you get into some of the more advanced protocols, you will see that what we are often doing is a lot of series of dosing and zeroing in different areas to make sure that the body is working properly. So we will just hold on here for a moment so you can see what this looks like. Hopefully it will do it. You'll note with the Pinnacle, you get that initial reactions in the middle. We won't talk about that here. This is definitely a topic for another video, but suffice it to say that it's a nice normal number. So there's not really anything going on in that area at this time. But we do want to make sure, and maybe got it. So you heard and saw that. So the D, the Z, this means that we've gotten that full connection and we are done. So you just look for those to appear on the screen. It is very, very simple, but it can seem overwhelming. But practice it on yourself, practice it on clients, and just recognize that depending on the situation, it can take a while. If you get repeated failed doses, so you're getting the Z straight away, this is when you might need to look to hydrating your client, give them a glass of water, and potentially even a different mode. For example, fMRSI, like I used in the evolution, tends to get doses and zeros faster, even if they're not the ideal frequency to do it, because they're inputting so much more energy to the body. Okay, so that's it for our first training. Thank you for joining me today. I will see you next week for another TSI 10-minute training. More interesting topics to come. Hopefully you found this helpful, and we will continue to provide this information to everyone here. Take care, everyone. Have a good weekend.